Hello, and welcome to the microlearning video on the use of the muscle function scale in children with congenital muscular torticollis. These supplemental materials are supported by the Knowledge Translation Committee of the American Physical Therapy Association in Pediatrics. It is intended to support the use of the recommendations found in the 2024 Congenital Muscular Torticollis CPG. The APTA provides access to these member-produced resources for informational purposes only. They are not intended to represent the position of the APTA. Today, we're going to talk about the muscle function scale. So in action statement 8 of the Congenital Muscular Torticollis CPG, you will find that muscle function of the lateral flexors of the neck should be rated by assessing lateral righting responses as described in the muscle function scale. For more details, you can turn to page 392 of the CMT CPG. We are lucky to have a guest speaker here today. Her name is Dr. Anna Öhman. She lives in Sweden and has her PhD. She has over 30 years of pediatric experience and has published 30 studies. Most impressively, she is the creator of the muscle function scale. So she did 2 studies. The first study looked at what is typical. How high should infants be able to right their head at various ages? In the second study, she looked at reliability and validity of the muscle function scale, and it was reliable and valid. My name is Katie Christensen. I am the Knowledge Translation Committee Supplement Development Coordinator, and I'm going to voice over this presentation because English is not Dr. Öhman's primary language. So in infants with congenital muscular torticollis, they often have an imbalance in their ability to right their head one side as compared to the other. So we needed a way to measure that, and that is where the muscle function scale Dr. Öhman created came from. So in her original scale, she had 5 categories that went from 0 to 4. In this updated scale that she updated because it improved reliability, she expanded that to have 6 categories, and the rating goes from 0 to 5. This scale is used for children that are 2 months and older. What you do is you tip that child horizontally and you watch what they do with their head. We're looking at how high can they right their head, and can they hold that for 5 seconds? They must hold it for 5 seconds in order to get that score. So we look at both the left and the right sides and compare the two. So a 0 on this scale means that the head is below the horizontal line. A 1 on this scale means that the head is on the horizontal line. A 2 means that the head is slightly above the horizontal line. A 3 means the head is high above the horizontal line, but less than 45 degrees. A 4 means that the head is also righted high above the horizontal line, but more than 45 degrees. And a 5 means that the head is almost vertical. In typical development, if you were to do the muscle function scale, you shouldn't see a difference in their ability to right their head left compared to right. However, in children with CMT, we often see a 2 to 3 point difference between sides. And we know that their ability to right their head improves as they get older. So we know that at the age of 2 months, the average score on the muscle function scale is 1 with a range of 2 to 4. By 4 months, the average score is 2.6 with a range of 2 to 4. By 6 months, the average is 3 with a range of 2 to 4. And then by 10 months, the average is 3.4 with a range of 3 to 4. Now, we can't produce the pictures that go along with the scale due to copyright purposes, but you can find them in the research article that Dr. Öhman published, and here is that information. What we are going to do today is show you 2 infants that are twins that both have torticollis and show you how this scale is used. This little boy has residual left torticollis. It's very mild. It's at the end of his treatment. And so Dr. Öhman is going to tip this baby horizontally, and we're going to watch this baby right their head and give them a score. She's going to do it both to the left and the right sides. So she's tipping this baby where he's using his left neck muscles to right his head. Look at that smile. And that is usually his tight neck muscles. And now she's going to do the same thing where he has to use his right neck muscles to lift his head. So I thought that when he used his left neck muscles, he scored a 4. So what I saw was that his head was high above horizontal and it was greater than 45 degrees. On the right side, I also thought his head was high above horizontal, but I didn't think it was more than 45 degrees, so I gave him a 3. Let's watch again and see if you agree. On this side, I decided he was a 4, above horizontal and more than 45 degrees. And then on this side, I thought he was more of a 3. I felt like he was high above horizontal still, but not greater than 45 degrees. Okay, so now we're going to look at his twin who has more significant left torticollis. And we're going to see what the difference is here. So she's using her left neck muscles, which is her tight neck muscle. I thought she was riding really high, so I gave her a 5 on this, that she was close to vertical. When she's using her right neck muscles here, it's really hard. So I think she's above horizontal, but not close to 45 degrees. So I gave her a 2, which is slightly above the horizontal line. So let's watch again and see if you agree. I gave her a 5 on this, which means that she's close to vertical and holds it for 5 seconds. And then I gave her a 2 on this side, meaning that she holds it slightly above horizontal. Thank you for watching this micro learning video. We appreciate your time.